Hello everyone. So this is Asif Khan, a registered pharmacist in Australia and a KAPS mentor. So today I have my student Sheryar, who have appeared for the KAPS exam yesterday. So he will share his experience about the KAPS exam for those students who will appear in July or in November exam.
Thank you, sir. So I enrolled myself at the Dreamers Academy with Dr. Asif, and my experience is that yesterday I appeared in the exam, and uh, there are two papers actually, to be very basic. Paper 1 and paper 2. Paper 1 consists of medicinal chemistry and pharmacology for the most part, and paper 2 consists of therapeutics and biopharmaceutics and pharmaceutics. So in paper 1, the medicinal chemistry part consisted of round about 15 questions, in which most of the basic structures of drugs and chemicals were there, such as pyridine, pyrrole. Like, you have to just identify the structure. And on the other side,
Okay.
there was
Which type of structures were repeated in your exam, like pyrrole, pyrimidine, mestranol, or which type?
yeah, like there were basic structures like pyrrole, pyrimidine, the structure of mestranol, and silic oxide structure. Like, what is the basic point in the silic oxide structure? Like,
Okay.
it is a pyrazole ring. So
And
this,
what about the stereochemistry? How many questions were repeated?
there were some basic questions from stereochemistry as well, like what are diastereoisomers, like what are the characteristics of diastereoisomers,
Okay.
and what are the characteristics for optical isomers.
Okay.
And
Any question from the biochemistry?
There were very few questions from biochemistry, and that were also simple ones, like, is gelatin a protein or not? Like,
Okay.
what is this?
So overall, how many questions were present in the chemistry part?
So overall, about 15 to 17 questions from the chemistry part were present.
Okay. And the remaining all questions were from the
From
pharmacology.
pharmacology part,
So
yeah.
what do you think? Which part of the pharmacology is very important?
So
Which chapters?
the chapters that are important are antibiotics,
And CVS?
CVS,
Endocrine?
cardiovascular pharmacology, endocrine pharmacology, CNS pharmacology, the
Okay.
most important part.
Okay.
And in the CNS pharmacology, the benzodiazepines, antidepressants, for the most part, they are very, very much important.
Okay.
And anti-epileptics as well. So in paper 1, from these chapters, the questions are not that much tough and difficult. Like, you can easily ask those questions if you have the basic know-how of pharmacology, like the mechanism of actions, some
Okay.
basic side effects.
Great. So it means that you think passing the paper 1 is very easy.
Yeah.
Okay. What about paper 2?
So paper 2 consisted of some tricky questions and some basic questions as well.
Please tell me about pharmaceutics.
Pharmaceutics part. So the pharmaceutic part was consist of compounding, like the basic compounding parameters for creams, ointments, and what are the surfactants, what are the incompatibilities between various kinds of surfactants. Like, we cannot mix cationic surfactants with anionic surfactants,
Okay.
or any formulation that contains cationic surfactant with any other formulation that contains surfactant of opposite charge, or even a drug of opposite charge. So we cannot compare, we cannot combine that.
Okay.
So these are some basics from the pharmaceutics.
Okay, so what do you think, if someone have strong knowledge about excipients, so he or she will easily pass the pharmaceutics?
Yeah, excipients are the most basic things. Like, one question was repeated in my exam, that is talc powder, is talcum powder a lubricant or diluent? So these questions like these are repeated.
Okay, good. And what about the biopharmaceutical calculations?
So biopharmaceutical calculations were consisted of VD, like volume of distribution,
Okay.
and half-life calculation,
Okay.
elimination rate constant calculation,
Okay.
and other questions from pharmaceutics, like calculation questions, were related to dilutions, like alcoholic dilutions and various kinds of other dilutions. So you have to know the basics of how you can perform dilutions. Like there are various formulas. So the calculations basically consisted of 15 to 16 questions.
Okay.
From both the
So mix.
biopharmaceutics part and
Okay.
from the pharmaceutic part. So they were mixed type of questions.
Okay.
So this calculation part also contribute to therapeutics part, like
Yes.
dilutions.
Yes. Yes.
So you can easily, get 5 to 6 questions right in this calculation part to get your exam cleared. Yeah.
Okay. And what about the other part, the therapeutics diseases knowledge is important or
Yeah,
not?
diseases knowledge is very much important, and on top of that, you also have to know about what kind of drug interactions are very much important, and the most important thing is the counseling points. Like how would you counsel a patient about a specific drug? Okay, and there are some counseling points which are very much important, like which are most appropriate. The questions are like that: select the most appropriate counseling point for a drug. And there are also some counseling points that you should remember that are least appropriate for a specific drug. So they are very much important. So
Okay.
having the know-how of these things about the therapeutics paper, like, which is a tricky one in my knowledge, as per my knowledge. So the knowledge of these things is very much important.
Okay. So what do you think? OTC drugs knowledge is important?
Yeah, OTC is very much important. Like you have to remember the doses of OTC preparations, such as the dose of cetirizine, for example, in children in various age population. So like this, each and every drug that is present as an OTC medication, that is very much important to remember the doses, the counseling points related to that, the side effects
Okay.
of those drugs.
Okay. So if someone study the recall specific files plus the Dreamers Academy notes, so these are more than enough to qualify the exam?
These are more than enough, and one thing I would like to mention to all those who are going to appear in the next exam, that please have a selective study plan.
Smart study.
Like you should be smart enough. Like you should not open the book. You should not go for the detailed study in any of the topic. And Sir Asif's guidance and the things he shared, the material he shared, you should hold it very tightly to yourself. Like you should abide by that, and you should not we can say that deviate from any of the thing or any of the guidance that Sir shares. So recalls knowledge, the knowledge from the classes, from the lectures, online lectures, and some of the basics that will help you clear your exam for the most part.
So you are satisfied from your exam?
I am very much satisfied, and paper 2 is not easy. That is tough, but you have to be patient, and you have to follow the guidances, you have to follow the recalls, you have to follow all the points that Sir shares, and inshallah each and every student will complete that and will be successful if he or she follows all those points.
Okay, best of luck, Shahriyar.
Thank you so much,
And
sir.
inshallah you will qualify the exam.
Inshallah. Thank you so much.